Welcome to my world. Today is another day to impart knowledge on health matters. I've always said, health is wealth, knowledge is power. Today I shall be making effort to let us understand more the variables that are involved in when you talk of sickness. There are so many types of diseases, and by classification, you have four, which are namely the infectious, the deficiency disease, the hereditary, and the physiological disease. The disease I want to talk about this time is the sickle cell disease. More or less, why are people sicklers? They call them sicklers. So it's just so easy that when you hear the word sicklers, you want to really know what really makes people sick. The four classification has really expressed it clearly, but the one that now concerns me to impart today is the sickle cell disease, which that falls under the hereditary disease. It could be hereditary disease, could be genetic or non-genetic, but the sickle cell disease is genetic because the parents must have the sickle cell genes before it can be transferred to any offspring. But in a situation where both parents have these sickle cell genes, then the person has the homologous gene, the SS gene, which classifies that person as regularly sick. The sickness that we really want to unravel, that what could be responsible for why we are always getting sick, that could just fall under our genetic makeup. The effort of our genes to mutate in order to survive. It has been found out that people in malaria infested or endemic areas have these sickle cell genes because the malaria parasites finds it difficult to penetrate the sickle cell gene. So you can see it is about something evolutionary and now causing another problem. So at times in the process of correcting one problem, you end up having another problem, not the finish, as they say in Nigeria. So let us hook on. Let us just watch the slide section where I would explain it systematically. Let us start from the definition. Sickle cell disease is a group of inherited red blood cell disorder. Approximately 5% of the world's population carries trait genes for hemoglobin disorders, mainly sickle cell and also thalassemia. Death from sickle cell disease complications occur mostly in children under 5 years, adolescents, and also pregnant women. This is sickle cell in a picture. What you are seeing is the blood vessel, the red blood cells shape, and the sickle cell shape. The sickle cell shape is very rigid and sticky. You find them sticking together and blocking the flow of blood in the blood vessels, resulting in oxygen not getting to many parts of the body. So that blockage is why are they sickle in shape? That is the question. Protein in the serum is made up of albumin and globulin. The globulin have the alpha, beta, the gamma chains. The normal hemoglobin in adult contains 2 alpha and 2 beta. Each alpha chain is 141 amino acid, while the beta is 146. The A2 is the thalassemia. It contains both the alpha and 2 delta. The sickle cells affect only red blood cells. Sickle cell anemia results from the single amino acid substitution of valine for glutamic acid in the beta chain, owing to a nucleotide defect that causes the production of abnormal beta chain in hemoglobin health. Because valine is hydrophobic amino acid, this imparts a sticky adhesive quality and result in sickling. The glutamic acid is a negatively charged amino acid and thus prevent red blood cells from sticking. This is the shape of the hemoglobin itself, the globin chains. You find the alpha, that is the beta globulin chain, and what you find, that red signifies the iron inside each chain. In fetal hemoglobin, the predominant hemoglobin during fetal development, there are 2 alpha chains and 2 different chains called the gamma chain. Is no longer the HbF accounts for approximately 80% of hemoglobin and A and 20% at birth. The F. When sickle cell are under stress or either osmotic changes, dehydration, oxygen tension low, their conformation changes to sickle shape and cluster together and block the capillary, preventing oxygen from getting to other parts. They are sequestered in the spleen, anemia, causing splenomegaly, and by age 5, because of the blockage, the spleen atrophied and non-existing again. You cannot see them. They have a shorter life cycle that explains the anemia too. Very fragile. Type of sickle cell disease. We have the HBSS, which we have just spoken about. The hemoglobin S is gotten from both parents and now called sickle cell anemia. The SS, the SC is a variant of the S. People who have this form of sickle cell disease have the C inheritance. Then we have just been mentioning the beta thalassemia. There are 2 types of beta thalassemia, the 0 HBS beta 0 and plus, the HBS beta plus. Those with HBS 0 thalassemia usually have a severe form of sickle cell disease. People with HBS beta plus thalassemia tend to have a milder form of SCD. There are other types too. People with SD, SE, SO, H, and other forms. People who have these forms, the abnormal type of hemoglobin, but are not as severe as the SS itself. Sickle cell traits, you don't even see much of this problem in those carrying the S gene, but they can't now meet say another the partner carrying the S trait, and they will now give birth to SS. That is why they usually advise people who have the trait not to marry each other. So that there are complications which could be 4 major type of complications are recognized in sickle cell anemia. The aplastic, that's when it affects the bone marrow, the area, the stem cells that produce the blood. Then the acute sequestration in the spleen, which are the hyperhemolytic. That is when the fragility, it's very fragile and it causes jaundice and everything. Then the vaso-occlusion crisis, which will result in serious pain for the patient. The kidney filter waste from blood and produces urine. When the kidney does not get enough oxygen, kidney cells can die early, making it harder for the kidneys to function properly. Stroke is also another problem, complication, because when oxygen does not get to all these vital organs, there will be stroke. You can also talk of acute chest syndrome, pulmonary, and other forms of sicknesses. The diagnosis in the lab, you will start with the screening test, CBC, that's complete blood count, evaluating all the cellular components, that is white blood cells, platelets, red blood cells, and what have you. The automation machine will do this in less than 1 minute on a small scale. These are the various shapes of the component cells. You have the monocyte, the lymphocyte, the neutrophil, eosinophil, and the basophil. They are immune cells, including the large lymphocyte. The red blood cells that we now see, that's the macrophage. That's the red cell shape, also called erythrocyte, is what is really affected when you are talking of sickle cell disease. The platelet is also there, produced, and these are normal cells you see. But when you do complete blood count, you check all these tests. Blood tests in addition. Sickle cell can be diagnosed while the baby is in the womb. Diagnostic tests before the baby is born, such as chorionic villus sampling and amniocentesis. The chorionic villus sample tests a tiny piece of the placenta called chorionic villus. Amniocentesis tests a small sample of the amniotic fluid surrounding the baby. These are all taken and tested. You can use amplification to really get the genetic makeup of these cells. So that then this is the blood film cell. When you make a thin film and you are now reading what you are seeing, that you can see the sickle cell shape. You can see the cells that are showing hollow centered, so that is anemic in a way. If they have a mark, then you call them target cells. So all these are very definitive, that it helps in really knowing if there are pikes. You call it poikilocytes, helping to define the kind of cells. Then you can also do the counting, the red blood cell counting, and for men, that's the value you find. Women levels are lower than the number of red blood cells. There is also the PCV, packed cell volume, that is done, where you compare the proportion of the red blood cells to the total volume of the blood, and usually men have up to 45% or more, while women have less, to about 38%, and used in diagnosing anemia. Amount of hemoglobin too, carrying capacity of oxygen, because that's the basic reason why the hemoglobin is there, to carry the oxygen to all the various parts. And so when you test for the hemoglobin contents, you are able to know what it is. Then there's the average size of the red blood cells. Mean cell volume is also useful in classifying whether there are vitamins problem. If it's microcytic, you're thinking of iron deficiency, or when it's macro, you are thinking of B12 and the folic acids. There are other variables. The ability of the size of the red blood cells, the amount of hemoglobin in an individual red blood cells, that should come in at 32 at normal picograms, and also you are talking of the mean cell hemoglobin concentration. These are values that when they are lower, you are talking of microcytic anemia or macrocytic anemia or normocytic. Further blood tests to diagnose blood disorder is the bone marrow biopsy, where you now check for the definitive cells that are pointing straight to a problem of anemia or sickle cell diseases. Prevention, that is also going to be helpful to help prevent the and reduce the occurrence of pain crisis, including the following: drink plenty of water so that the cells will not stick. Try not to get too hot or too cold. That stress the body. Try to avoid places or situations that cause exposure to high altitude. That affects the oxygen in the blood vessels. Try also to avoid places or situations with exposure to low oxygen level, like for example mountain climbing or exercising extremely hard. These are not what is expected of a sickler, so that you will not get into the crisis. The treatment depends on the symptom. When you look at this, it's so easy. These are problems that you could, so the ones that require folic acid preparation, especially when you have done the CBC, the complete blood counts. Then there is also hemotransfusion used in some cases. Pains, when there is too much pain, you are talking of analgesics to give the patient. Also, erythropoietin we produced by the kidney when there is a suspicious kidney problem. Then intravenous rehydration when there is occlusion, that's serious pain, vaso-occlusion pain crisis. There is intravenous rehydration. There is also immunization. You want the patient, especially the children, the babies, to get all their vaccine so that they do not experience the infection problem that could end their life so early. And when you are able to do all that, including the hydroxyl urea, when the hemolysis and the antibiotic is also very helpful in preventing infection. Blood transfusion treatment. Because blood contains iron, transfusion can lead to a condition called iron overload, in which too much iron build up in the body. Iron overload can cause life-threatening damages to the liver and other organs. Therefore, it is important for people with SCD receiving regular blood transfusion to also receive treatment to reduce excess iron in the body. This type of treatment is known as iron chelation therapy. It's very useful to consider the iron poisoning. The treatment also, the latest update is this oxybrator holds the hemoglobin in a particular shape so that it does not sickle, that prevents sickle cell from stacking, that is clogging. And it is a prescription medicine used for treatment of sickle cell disease in adults and children above 4 years of age. You don't use it in children less than 4 years. It is accessible only through a special clinic. The stem cell transplant is another one.